Hello, everyone. My name is Jordan Vega, and my topic is on SIADH. That's what we'll be discussing. Some of the things that I'll be discussing are the anatomy, physiology, pathophysiology, diagnosis, treatment, and artificial intelligence, all associated to SIADH. What is SIADH? So SIADH stands for Syndrome of Inappropriate Antidiuretic Hormone. And basically it occurs when a surplus of the hormone is produced, causing the body to retain fluids. So below here, I have a figure that basically describes where um, the hormone is being produced at. So antidiuretic hormone is produced in the posterior pituitary gland, and it is right next to the hypothalamus. So they're in that same region of the brain. Antidiuretic hormone is responsible for regulating fluid secretion and retention. The hypothalamus is in charge of synthesizing antidiuretic hormone before being released from the pituitary gland into the bloodstream. Once released into the bloodstream, antidiuretic hormone causes the kidneys to retain fluid to prevent dehydration. Once antidiuretic begins making its way to the kidneys, it it goes to the collecting ducts of the nephrons, which increases water retention, which is kind of what's illustrated here. This is the nephron, and these are uh the collecting ducts of the nephron. When the fluids are overabsorbed, a person can become what's called euvolemic hyponatremic, which is where the sodium levels become depleted beyond homeostatic levels. So euvolemic hyponatremia is caused by SIADH. It's a direct cause. And it's a severe problem because it can cause blood volume to increase, which can directly affect the blood vessels throughout the entire body. So hyponatremia is, as I said earlier, is directly caused by SIADH, and it's a severe, acute, and chronic problem because of its direct effect on our cardiovascular system. It creates an overaccumulation of fluids, which begins to build up in our blood and then begins to affect our skeletal and smooth muscles. Um, in severely progressed hyponatremia caused by SIADH, swelling of our neurons or brain cells causes symptoms to manifest, such as headaches, confusion, seizures, and in really severe cases, comatose and mortality. So here in this image, there's an illustration of what normal osmolality levels should look like in the brain, and what it looks like when a surplus begins to accumulate in the brain, and some of the effects that happen to our brain when that happens, um, such as the loss of sodium and potassium, the loss of electrolytes, and osmotic demyelination. So this figure here may look familiar. It's from our book, and it basically illustrates the negative feedback responses that occur when antidiuretic hormone is being over overproduced, underproduced, or properly produced, right? So when the body is in homeostasis, the posterior pituitary gland produces the correct amount of antidiuretic hormone through a hormonal feedback loop. The hypothalamus then sends the necessary amount of antidiuretic hormone to our kidneys, and the kidneys then properly regulate sodium levels and blood volume in the body to maintain homeostasis in each and every organ system. So the binding of antidiuretic hormone to what's called vasopressin 2 receptors, or V2 receptors, on the kidney cells activate a biochemical pathway involving an enzyme known as adenylate cyclase. I believe I'm pronouncing it correct. Um, Baroreceptors in our aortic arch and carotid sinus can then detect changes in the blood volume and our blood pressure, which then sends signals to the hypothalamus via neurotransmitters. Um, Neurons in the hypothalamus then communicate with the pituitary gland through these neurotransmitters, such as glutamate and GABA, to modulate the release of antidiuretic hormone. Um, Antidiuretic hormone, it binds to V2 receptors in the kidneys, collecting ducts, causing an increase of aquaporin to water channels into the cell membranes. So this is a problem because it enhances water reabsorption beyond the body's actual needs, which ultimately leads to water retention and dilution of our blood. Um, when neurons begin to swell, it begins to cause an osmotic imbalance, and it can lead to cerebral edema, which then leads to an increased intracranial pressure, which can manifest symptoms such as headaches, confusion, and altered mental status. The excessive water retention increases blood volume, um, which then increases blood pressure and begins to put a strain on our hearts. The baroreceptors are able to detect this disturbance in homeostasis, and the problem is they can't adequately reduce the amount of antidiuretic hormone being reduced or being released due to overriding pathological signals caused by SIADH. Muscle tissues are also impacted by the electrolyte imbalance that occurs in SIADH due to the low levels of sodium in the body, which then begin to affect our muscle cells and their function, which end up leading to symptoms such as muscle cramps, weakness, fatigue. Our liver is also affected. It's not directly impacted by SIADH, but it can be affected because it tries to compensate for the electrolyte imbalances. So it causes an unnecessary strain on our liver. So these are all the organs that are affected by SIADH. Diagnosis. So the diagnosis is diagnosed through a series of a few different tests, and before being diagnosed, even after reviewing these tests, other endocrine problems must be ruled out prior to the official diagnosis of SIADH. So, for example, the prior initial ruling out of endocrine problems that they have to rule out for is adrenal gland and thyroid disorders before diagnosing someone with SIADH. Um, the clinical evaluation, laboratory tests, and imaging such as CT and X-rays are how they diagnose it. There's a bunch of different tests that they also test for to see if there's an imbalance in the sodium levels. And ultimately, what these laboratory tests are testing for is to see if the serum sodium levels are below 135 MEq per liter, which are indicative of low plasma osmolality treatment. So the treatments can vary based on the severity of SIADH. In mild symptoms of SIADH, interventions such as fluid restrictions can be effective in resolving mild symptoms of SIADH. In more moderate circumstances, they may need loop diuretics such as sodium chloride in the form of tablets, or drugs such as furosemide or even IV saline to promote homeostatic sodium levels. In severe symptoms of SIADH, more extensive interventions may be needed, such as the use of vasopressin receptor antagonist medications, and they can help stabilize a person's sodium levels along with some hypertonic saline infused intravenously. And the way they'll know that the issue's been resolved is that a person will have a sodium correction of more than 130 MEq per liter, and that will be indicative of the problem being resolved. Artificial intelligence. So when I was researching the artificial intelligence associated with the uh, resolution of SIADH, I found that there is a deep learning model that can detect electrolyte imbalances such as hyponatremia in people based on their electrocardiograms and the algorithm that they have full of people who have had hyponatremia and who have normal EKGs, and based on the algorithm, determine if a person has an electrolyte imbalance. So the demographics associated with people who have SIADH in the US, um, there wasn't any actual demographics that are more affected than any other. Um, but research that I found stated that 2,500 to 3,000 people per every 100,000 people are affected by SIADH every year. And it is frequently seen in older adults and children, particularly those who are have infections such as meningitis or pneumonia. So for international demographics, it was a little more difficult to find statistics as far as how many people are affected by SIADH abroad. But I did happen to find some information that said that there was a strong correlation between people who have tuberculosis and pneumonia to have SIADH as a secondary problem. The countries with the highest rates of tuberculosis in the world that I did find were India, Indonesia, China, the Philippines, Pakistan, Nigeria, Bangladesh, and the DRC, or the Democratic Republic of Congo. And these are my references.